Type 2 diabetes is a metabolic disorder that causes sugar, in the form of glucose, to accumulate in the blood rather than being used as fuel by the cells in our body. When we eat, food is broken down by our digestive system into nutrient molecules that are then absorbed through our digestive tract for use by the body. Foods containing carbohydrates or various sugars are broken down into glucose. Glucose is an important source of fuel for many organs in our body. However, to be able to use the glucose for fuel, the glucose molecule must first enter into the cell. The pancreas produces a hormone called insulin, a chemical messenger essential for the entry of glucose into cells. As the blood glucose levels rise after a meal, insulin is released into the bloodstream and sets processes in motion to trigger the removal of glucose from the blood to enter into the cells. In type 2 diabetes, the cells become resistant to insulin and ignore its message to absorb glucose. This is known as insulin resistance. In addition, in type 2 diabetes, the pancreas is unable to produce the greater amounts of insulin needed to trigger these resistant cells to take in glucose from the bloodstream. The most notable symptom of diabetes is frequent urination and excessive thirst. Other symptoms include weakness, drowsiness, and blurred vision. These are caused by chemical imbalances in the blood related to high levels of blood glucose. About 1 in 4 people with type 2 diabetes are unaware that they have the disease. It is important to catch diabetes early. Over time, high blood glucose damages the blood vessels, which can damage the organs that these vessels supply, leading to a variety of health complications. Damage to the small or micro blood vessels can cause vision problems, including loss of sight, nerve damage, and kidney disease. Damage to larger or macro blood vessels can lead to cardiovascular complications such as heart disease, stroke, and poor blood circulation. Overweight and inactivity are major causes of diabetes. A family history of diabetes significantly increases your risk of developing the disease. Certain ethnic populations are also at increased risk of developing type 2 diabetes. Finally, some medications may increase your diabetes risk, specifically corticosteroids, thiazide diuretics, drugs used to treat certain mental illnesses, and some antiretrovirals used to treat HIV infection. In summary, type 2 diabetes is a metabolic disorder. It causes sugar, in the form of glucose, to accumulate in the blood rather than being used as fuel for the cells in our body. If not diagnosed and treated in a timely manner, type 2 diabetes can lead to many health complications. Diabetes is diagnosed through laboratory blood tests, the fasting blood glucose test, hemoglobin A1C test, and the oral glucose tolerance test. The fasting blood glucose test measures blood glucose in a person who has not eaten for at least 8 hours. Diabetes is diagnosed when fasting blood glucose is 126 milligrams per deciliter or higher on 2 separate laboratory tests. A second test measures hemoglobin A1C, which is an estimate of average blood glucose levels over the last 3 months. Diabetes is diagnosed when an A1C is 6.5% or higher on 2 separate occasions. Another test is the oral glucose tolerance test, or OGTT. This test measures your blood glucose 2 hours after drinking a glucose liquid. Diabetes is diagnosed when the glucose tolerance test level is 200 milligrams per deciliter or higher. If one or more of these tests are positive, your doctor will repeat the test to confirm the diagnosis of diabetes. If test results are close to the higher end of normal range, your chances of developing diabetes are increased, and you may have prediabetes. If diabetes is not diagnosed at an early stage, or blood glucose levels are not kept in the normal range, multiple complications can occur. Over time, high glucose levels can cause damage to small and large blood vessels. Both higher and lower than normal blood glucose levels can affect the eyes. High blood glucose over the long term causes diabetic retinopathy, and severely low blood glucose causes bleeding inside the eye. Diabetes remains the leading cause of blindness in the United States. Diabetic kidney disease, also known as diabetic nephropathy, is another serious complication that remains the leading cause of kidney failure requiring dialysis or kidney transplantation. About 1 in 3 persons with diabetes have some degree of nerve damage, known as diabetic neuropathy, at the time of diagnosis. Most commonly, this causes loss of sensation in the hands and feet. Damage to large blood vessels may cause heart attacks, strokes, and blood flow problems that can lead to foot ulcers or even amputations. Fortunately, diagnosing diabetes at an early stage and managing it well can help delay or prevent many of these complications. Regular checkups are important because at the early stages of diabetes or its complications, a person may not have any symptoms. For the person who has been diagnosed with diabetes, monitoring is very important. Blood glucose monitoring and periodic A1C testing can help you stay on track in controlling your diabetes. Your doctor will also carry out other lab tests, such as monitoring of blood cholesterol and triglyceride levels, as well as carry out a urine protein test to monitor kidney function. Regular foot examinations and preventative care are important, especially if you have nerve damage in your feet. Your eyes should also be examined regularly for retinopathy, glaucoma, and cataracts. The pneumonia vaccine and annual influenza vaccines are recommended for most patients with type 2 diabetes. In summary, type 2 diabetes is diagnosed through various blood tests. If not diagnosed early or if inadequately controlled, diabetes can lead to damage of important organs that impact health and quality of life. Regular monitoring of diabetes with your doctor can help prevent these complications or detect them at an early stage while they are still treatable. The goal of type 2 diabetes treatment is to safely keep blood glucose within the normal range. Improving diet and exercising regularly are important parts of type 2 diabetes management and treatment. In overweight or obese persons, weight loss can often return blood glucose levels to normal if it occurs early. Exercise decreases the resistance of the cells to the action of insulin, making it easier for the glucose to enter the cells from the bloodstream. This benefit of exercise occurs even if there is no associated weight loss. If weight loss, improved diet, and exercise do not reduce blood glucose levels adequately, then medication is the next step. There are a variety of oral and injectable medications used to treat type 2 diabetes. Most persons with diabetes are initially prescribed metformin. Metformin blocks the production of glucose by the liver. Metformin also decreases the resistance of cells to insulin, making it easier for the cells to take up glucose from the bloodstream. After metformin, doctors often prescribe sulfonylureas or DPP-4 inhibitors. Like metformin, sulfonylureas are inexpensive and effective. They work by increasing insulin release from the pancreas. However, they may cause hypoglycemia. Hypoglycemia occurs when the blood glucose level drops too low. It is important for patients to recognize the symptoms of hypoglycemia, such as shakiness, sweating, palpitations, and weakness, before it leads to more dangerous effects such as confusion, fainting, or loss of consciousness. Incretins are essential chemicals secreted by the gut in response to meals and have important anti-diabetic effects. They work by slowing the emptying of the stomach so you feel full longer, increasing insulin secretion, improving insulin sensitivity, and decreasing glucose production. In diabetes, incretin levels are reduced. There are two types of medications that work to improve the levels of incretins in the body: the oral DPP-4 inhibitors and the injectable GLP-1 analogs. The DPP-4 inhibitors prevent the breakdown of incretin hormones and increase their anti-diabetic effects. These newer medicines work by increasing insulin production. They have little risk of hypoglycemia. They also make cells more sensitive to the action of insulin. The injectable GLP-1 analogs replace the incretins directly. They also slow the movement of food through the digestive tract so you feel fuller longer. They improve insulin secretion and may promote weight loss. They also have a low risk of hypoglycemia. Thiazolidinediones are another class of oral anti-diabetic agents. They work by making the cells more sensitive to insulin and decreasing glucose production. They do not cause hypoglycemia, but they may cause weight gain. Other types of pills for diabetes include SGLT2 inhibitors, alpha-glucosidase inhibitors, and bromocriptine and colesevelam. Over time, medications often become less effective. Rather than switching a medication, your doctor may combine two different ones that have been shown to work well together. If your blood glucose cannot be controlled by pills alone, your doctor may put you on insulin. Insulin is the most common injectable medication used to treat diabetes. There are two types of insulin: long-acting or basal insulin and short-acting or mealtime insulin. An insulin pump can be used in type 2 diabetes to deliver insulin just like the pancreas. Healthy diet, exercise, and maintaining a healthy body weight are important aspects of diabetes management, even if you are on medications. You should develop a self-management plan with your doctor and other health professionals, such as a dietitian and certified fitness professional. Your plan should include eating healthy foods and incorporating regular moderate-intensity exercise into your lifestyle. Important dietary interventions specific to diabetes include reducing sugars, starches, and fatty foods. Strategies to reduce stress at home and at work, ensuring adequate sleep, and managing depression, if present, are also important. In summary, type 2 diabetes is treated by a combination of diet, exercise, and medication. A variety of drugs are available to treat diabetes. However, self-management through lifestyle plays a very important role.